On 2021 World Health Day, WHO recognizes the challenges and opportunities towards building a fairer and healthier post-COVID-19 world. The COVID-19 pandemic has exposed and exacerbated inequalities and negatively impact health and socio-economic outcomes between and among vulnerable groups. These inequities impede the right of every individual to achieve the highest standards of physical and mental health. In countries of all income and development levels, health status of individuals and communities mirror the prevailing social gradient. It is always the poorer and more vulnerable communities who lack access to adequate health care. We see the result in how the burden of both communicable diseases like TB, hepatitis, and HIV, and of non-communicable diseases like stroke and heart disease is heavier among poor and disadvantaged groups. This burden further entrenches these groups into poverty, making it harder for them to improve their life conditions, to escape poverty, and to become healthier. To remedy these and other health inequalities, and to create a fairer and healthier post-pandemic world, WHO is calling on leaders in the health sector and beyond to make concerted efforts towards strengthening health system resilience and to ensure that all people have living and working conditions that are conducive to lifelong health and well-being. In Bhutan, WHO consistently partners with Ministry of Health and other stakeholders to expand access to people-centered primary health care for all Bhutanese. Bhutan has adopted WHO's PenHeart programs to address the country's challenges such as the barriers of geographical and transportation access. Urban and rural communities who lacked access to health centers because of these barriers now get health care at their doorstep. Such programs make it possible for all Bhutanese to lead healthy lives and so doing make healthcare more equitable and accessible. This year's theme also highlights the responsibility communities play in shaping healthcare. Bhutan's response to the pandemic has been overall success, and the credit for it belongs to how the nation rallied together to fight the disease. We can and must prevail over the pandemic and all public health crises. We must reduce and ultimately end inequities and accelerate towards universal health care. All people have the right to achieve the highest attainable standard of physical and mental health. A fairer and healthier world is possible. We must dare to be bold and achieve our vision.